I'm Ryan Wood. This is my central line dressing video. So to first come in the room, I walk into the patient's room, introduce myself, explain to the patient that they're going to have their central line dressing changed, and just explain to them the procedure if they've ever had it done before, and what they should expect and stuff like that. So I should provide privacy, put on hand hygiene, provide hand hygiene, and put on gloves, and I would have the patient put on a mask as well as I'm going to put on a mask to prevent any airborne, to prevent any possible infections to the central line. So as I look at the central line, it's going to be clear, and I'm going to look at it first for any signs of infection, or ask the patient if they have any pain at all. Then I can have the patient, if it's right here, have the patient lean to the left so it's more of an easy access. So then at first now I can start removing the dressing, and this can be very painful to the patient, so I'll try to be very careful and ask them how they're doing with their pain, and I'll try to take the tegaderm off close to the skin as I can, so that's less painful for the patient. So now that the tegaderm is off, I can also assess if the central line has been withdrawn from the patient at all, if it's hasn't been well secured, and I can let the physician know where if the central line has been out at all. And then now I can look at the central line. If there's any, I can smell for any type of odor or drainage, and if there is drainage, I can get a culture and to send it up to the lab so if there's any type of infection. So next I'm going to open up my sterile field. Before that, I would remove my gloves, perform hand hygiene, and then I'll open my sterile field. And then I can put on my sterile gloves. Now that my sterile gloves are on, I want to first clean the central line site by getting my swabs right here. I can open them up on my sterile field, and there are typically 3 swabs. I can take one swab at a time, leaving in my sterile field, and cleaning the central line, the area, and up and down, vertical, side to side, just an overall motion, just swiping the area with a radius of 2 to 4 inches, making sure everything is clean, throwing it away, getting a new one. And each one I would clean for 30 seconds approximately. And I can even clean the tubings, the line, and the overall central line, just make sure everything is clean and sterile as possible. So then once everything has been cleaned properly and efficiently, I can let it air dry, and once it's done being air dried, I can put on my tegaderm patch. And with the tegaderm patch, I need to first make sure that the clear area is over the central line site, so that I can see if anything has been dislodged or any problems or issues have been shown. So then, after this, I can document how the patient tolerated the procedure, if he's in any pain, or if there still is any swelling, or if the central line tubing has been dislodged at all. And with the tegaderm, I would put the patient's name and date of birth and my initials, see what time and how long the placement has been on there. And then other than that, that should conclude the video.